Correct, Alan. So the incidence of, or the prevalence of infertility is increasing worldwide. In sub-Saharan Africa and population-dense areas like South America or Asia, the incidence is much higher, and it's mainly as a result of tubal disease and obstruction of the fallopian tubes. Also there, you would find that there's an increase in the prevalence of male infertility.
Right. Because often there seems to be this, almost default, if it's infertility, it's got to be the lady. But that's not the case, because, more often than not, men are also challenged.
Interestingly, so last year, the Sunday Times published a very good article for some work that had come out from Tigerberg.
Right.
By Professor Tina Skruer, who is a world authority on semen analysis. And a study done in South Africa had shown that 12% of men in South Africa were not producing any sperm at all.
12% of men?
And 34% had subfertility.
So what would be one of the main reasons why men would not produce sperm?
So the main concern in that particular study was the lifestyle changes that led to an increase in the incidence of TB, HIV, sexually transmitted infections that have caused obstructive problems in the reproductive system, not allowing them to produce sperm. And then there are various other factors, like lifestyle changes, like recreational drugs, smoking, alcohol, recreational drugs itself. Then the category of causes, like where young men in the reproductive age may have testicular tumors. So it's very important as part of the investigations to do a semen analysis in a couple who are trying to fall pregnant.
So would you say that, the numbers are escalating? Looking at your practice and, your colleagues around the country, are they talking about, more people are presenting with challenges around fertility?
Absolutely. I think so. That's worldwide. In particular in South Africa, the incidence of fertility problems are rising. And that's both in male-dominated fertility issues and female problems. The female issues is a separate category. So it depends on possibly the age. One of the factors we find in Western women is that the emancipation of women and the education of women, so they establish their careers, they have their partners late in life, plan to have a baby later in life. So age is a very important factor that affects your ovarian reserve.
So if someone presents with infertility in their early 40s, could we assume that at some point they did not have fertility challenges in their late teens or early 20s? Or if you are infertile in your 40s, you would have been infertile earlier on in life?
No, so there are a lot of the problems that are acquired problems that may only occur later in life. Now, if you take a woman, for example, after the age of 35, fertility rapidly declines. At the age of 40, the chance of her falling pregnant is less than 10%.
Less than 10 after the age of 40?
Yes.
Okay. And in terms of age, regarding fertility, is it a particular age group that you're seeing as patients who are presenting?
I think the majority of patients that are presenting now are in their early 30s to mid-30s. So, and then there are a few that have left it quite late. That is why it's very important. I think that needs to be emphasized in terms of when does a couple seek attention and at what stage of their life. So it's not as soon as you stop the pill that the next month you haven't fallen pregnant that you decide to go for investigations. So if you're under 35, then we wait for at least 1 year of unprotected but regular and frequent intercourse. And if a couple is not conceived, then assume that there may be a problem and seek the guidance of a gynaecologist.
So after you stop the contraception, you've got to wait at least 12 months then?
For at least 12 months if you're under 35.
Okay.
But if you're over 35, you must be investigated within 6 months. If you're over 38, you should be investigated within 3 months of regular periods. And that's mainly as a result of the quality of eggs start to decline. So they run out of eggs within the ovaries.
So in terms of the challenge of infertility, it's not like there'd be symptoms, that would be presented. So there's no warning signs that you can say, hey, listen, I need to go check it out. So more often than not, what's the guiding issue that people will say, listen, we've been trying for a year and a half and we haven't fallen pregnant, that's when they come to see you? Or Is there something else that they could be looking out for as a warning sign, as a potential indicator?
Alan, that's an important question. In some cases, there are warning signs. So where there may be some medical issues like endometriosis will give you severe period-like pain, pain during ovulation, pain during intimacy. So those are clinical signs pointing towards endometriosis. And then if you've got patients, women that have got irregular cycles, so if they're not ovulating every month, then they may miss a period, or they may get irregular periods every couple of weeks. So those are pointers to any hormonal disturbances, and they should seek attention earlier.